Hello, For Your CNA fans, and welcome to another episode of Motivation Monday. I'm your host, Miss Patty from For Your CNA, and today I want to talk to you about PCTs, or Patient Care Techs, and how they differ from CNAs. A CNA, by very definition, is a certified nursing assistant. So that means that you're there to help the nurses. And you're going to receive a certain amount of training to do that in your training program that's going to meet federal guidelines. So most CNA training is going to center around patient care skills, such as grooming and bathing and dressing and toileting and eating, the things that you do for yourself every day. But if you suddenly weren't able to do them and needed some help, CNAs are available to help with those types of tasks. Now, in addition to that, CNAs also learn some nursing types of tasks, such as repositioning patients, caring for catheters, emptying drainage bags, vital signs, and those types of skills. So places like nursing homes, assisted living facilities, and home care, this level of training will be more than adequate for the skills that you will be required to perform in those settings. But there are some settings where CNAs are going to require additional skills in order to effectively help the nurses. So places like outpatient surgery centers or rehab centers or hospitals, you may have to receive additional training to assist the nurses in those particular settings. And the types of training that you would receive actually are going to vary depending on the types of skills that are required in each one of those settings. So let me explain real quick. If you're going to work in an outpatient surgery center, so this is a place where a patient goes in, has surgery, and goes home that day. They don't stay overnight. This is in and out outpatient surgery. If you're going to work in the post-op sections, this is after surgery has occurred, when the patient's getting ready to go home, and they do have CNAs in this setting, you may be trained on taking IVs out, taking out catheters, making sure that the patient voids or urinates after a catheter has been removed, monitoring for vital signs, for signs of hemodynamic instability or that the patient is not doing well, so monitoring their vital signs. So these are additional tasks that you may be trained to do based on the setting that you're working in. If you're working in a rehab area, you may, with fresh patients just out of surgery, you may be assigned to help the nurse with simple dressing changes, not sterile dressings, but simple dressing changes. You may be responsible for monitoring IV flow rates. You may be responsible for performing range of motion under the direction of a physical therapist. So there's additional skills that you may have to cultivate depending on the setting that you're working in. And that's where PCT comes in. Now, PCTs can also be called CNA2s. They can be called nurse techs. There's a lot of different titles for this, but they all mean about the same thing. They just mean it's a CNA with some additional training based on the needs of the setting that they're working in. So CNAs can be trained to do anything the nurse can do. So you can be trained to put catheters in. You can be trained to take catheters out. You can be trained to put IVs in. You can be trained to take IVs out. You can be trained to do simple dressing changes. You can be trained to set up sterile fields for bedside procedures. You can be trained to do anything the nurse can do, and you're operating under the direction of the nurse. Remember, you're still a CNA, certified nursing assistant. So based on the policies and procedures and job descriptions of your facility and the state law, which your facility is responsible for knowing, you can receive additional training on any of these tasks, and you would be performing them as part of your daily routine. Now, in the hospital, CNAs are often trained in taking blood or phlebotomy, as well as reading EKGs. So those are the monitors that are that display heart rhythms, like all those little squiggly lines, and you would have to learn how to read those to identify whether the patient is having any sort of a serious cardiac abnormality that needs to be relayed to the nurse quickly. So there's a lot of different skills that CNAs can be taught in addition to their basic CNA training, and then they just get a title of PCT or CNA2 or nurse tech. That just designates that they've had a little bit of additional training. Now remember that every workplace that you work will have additional training requirements. So you may be working in a hospital right now as a PCT, drawing blood, watching monitors, doing vital signs, basic CNA functions, and then you move to a rehab setting and you all of a sudden have to learn how to take catheters out, which you've never done before. They can train you on that, and that can be part of your daily job duties. That's certainly okay as long as it meets the requirements of the job description where you're working, their policies and procedures, as well as the state guidelines for allowable CNA tasks. And those are certainly questions that you can ask during your training. Now, it's very important to note, though, even though any CNA can receive this training and learn any of these skills, you cannot perform the skills if you have not been trained to do them. So let's say that you're a CNA working at a nursing home today. You go to work at a hospital next week, and the hospital requires that their CNAs know how to take out catheters on this particular floor that you're working on. But you have not received that training yet. If a nurse tells you, hey, I need you to go take a catheter out in room 212, and you have not received that training, you don't take the catheter out. Your responsibility is to tell the nurse, I'm sorry, I've not been trained in that task. I cannot perform it. And the nurse will then either take the catheter out herself, or in some cases they will actually do the training at the bedside with you if they know that you have not had that training, or they'll make arrangements for you to go through their educational coordinator and receive the staff training. Every institution is set up a little bit differently in how that training is going to occur. But it's important to understand that PCT is nothing more than a CNA with additional skills that have been acquired through training in the workplace. And those skills are going to differ a little bit based on where the CNA is working and what skills are required in that setting. So I hope this cleared that up for you, and don't be afraid to take on new skills. It really makes you much more valuable, much more marketable, and helps you learn a little bit in the process as well. So don't be afraid to take on additional training based on the workplace that you're working at. And that is a wonderful interview question. Are there any additional skills that I'll be required to obtain while I'm working here? And that will give you a good opportunity to see the additional skills that you'll be required to develop in that position. If you found this helpful, please give us a thumbs up. Make sure you subscribe to our channel, ring the bell for notifications, and we'll let you know when we post a new video in each of our weekly series: Motivation Monday, Test Tip Tuesday, Workplace Wednesday, Newsflash Thursday, Fashion Friday, and Career Spotlight Saturday, and we'd love to see you at each one of those. Drop us a comment below. Let us know if you've received any additional training, what additional skills you have, if you're working as a PCT, or if you're just interested in becoming a PCT in another healthcare setting. We'd love to hear your thoughts on this. Until next time, happy caregiving.